Good afternoon, Mr. Russell. My name is Loretta. I'm the nurse practitioner, and I'll be doing your examination. So right now I'm going to ask you some questions about your health history, your family history, and then when we're done there, I'll have someone come in and get your vital signs, and then you get in a gown and we'll get started on your physical examination. Okay, so is there any medical history? Do you have any medical history? Do you take any medications for anything at all?
Yes. Vyvanse.
Vyvanse, okay. And that's for the ADHD that you get from Dr. Wu?
Mm-hmm.
Okay. Any other diagnoses that you've had from other doctors?
No.
No? Okay. How about your family history? Does your mom or your dad have any diabetes or high blood pressure or anything?
My father had diabetes.
Okay. Do you have any brothers or sisters?
Yes.
Okay.
2 brothers and a sister.
Okay. Any medical history with them that you know of?
No.
Oh, very healthy. And you are the oldest?
The youngest.
Okay. You think about that. And how old are you?
25.
25 years old. Okay. Immunizations. I see that all your immunizations up to date except for the flu. It's about that time of the year. Are you thinking about getting the flu vaccine?
Yes, I am.
Okay. Okay, good. 'Cause that'd be really important. Let me see. So your nutritional status. How do you do you eat a lot of junk food? Do you eat a lot of vegetables? How do you? What's your diet?
Yeah, I pretty well-rounded. Vegetables, fruit,
Okay.
steak.
Okay. Occasional junk food, but not a lot.
Oh yeah.
Okay. Let me see if there's anything else in here. Okay. So this exam is for a physical exam that you do for your employer, and I understand they pay you guys some money if you get it every year.
Mm-hmm.
And how have you been doing? Is this your first time or?
Yeah, it's the first time.
Okay, well that's good. That's really good. All right, so I'm going to step out and my MSA will come in and get some vital signs, and then we'll be ready to go. Okay?
My name is Gina, and I'll be taking your Bible.
Come in.
So we just got your vitals, which is doing pretty good. 107/67 is really good blood pressure. Are you an athlete?
Yes.
What do you do?
A little basketball, a little working out, a little fighting.
Okay, so what I'm going to do is I'm going to step out. I'm going to have you get into this gown. And you can leave take your t-shirt, you leave your underwear on, and socks. And then it fastens in the back. And we just have a seat up here. And I'll have the door cracked, so just say I'm ready, and I'll come back here.
All right.
We'll start our time. Okay. Okay. So while I start my assessment, I'm also going to be asking you some questions about your allergies, medical, personal, that kind of thing.
Okay.
If there's anything you're uncomfortable with, just let me know.
Okay.
So, how old are you, sir?
25.
25. Any children? Are you married?
No.
Okay. Speaking of that, then, are you satisfied? Do you practice safe sex?
Yes.
And how do you do that?
Condoms and.
Very good. Okay, Mr. Russell. First thing I'm going to do is start with your head. Have you been having any headaches?
No.
No. Okay.
Here's a little greasy.
You swallow for me? Very good. Any pain here?
No.
Okay. Alright. Take a peek at your ear here.
Never.
Okay. Your eardrums are pearly colored, no redness. Have any pain or anything in your ears?
No.
Okay, good. You keep them pretty good, clean with wax. What do you do?
Clean with wax?
I mean, they're wax-free.
Yes.
So how do you clean your ears out? What do you use?
I do use Q-tips.
You say that as if
Preferably-
you know you're not supposed to.
Because I have heard you're not supposed to.
Mhm.
Preferably the plastic kind, but typically the cotton.
Okay. Alright. So, You don't wear glasses. Have you ever worn glasses?
Yes.
And do you have contacts on now?
No, I actually got a LASIK surgery in February.
February of this year?
Yes.
Awesome. And how is that working out for you?
Quite well, quite well.
Good.
Definitely worth the money.
I'm hoping there's light. So don't go too close. Oh, yeah, I'm okay. All right. Just look straight ahead for me. One more straight ahead. Just don't look straight ahead of there, please. Okay. I'm going to do hearing test. I'm going to put this up on your head, sir. I want you to tell me when you don't hear the vibration anymore, okay? Okay. Test is the Rhine test. I'm going to put this here, and you tell me when you can't hear it anymore, and then I'm going to put it in front of your ear, and then you tell me when you can't hear it anymore. It's comparing your ear hearing. Okay.
No.
Okay. And try this one out of here.
No. No.
So it's equal. Okay, Mr. Russell. I'm going to ask you some personal questions. One is your sexual habits. Do you and your partner practice safe sex, and if so, how do you do that?
Yes, with condoms and birth control.
Okay. Good. Let's see. Can you give me a little bit of your medical history? Do you have any, do you take any medications for anything?
Yes, Vyvanse.
Vyvanse?
Mm-hmm.
And you take that for?
ADHD.
Okay. And how much do you take today?
70 milligrams, 1 pill a day.
Okay. How long have you been on this pill?
About a year.
Okay. And why did you decide to go see, and who's the doctor? Dr. Wu? I have records down here.
Yes.
So what made you go to him?
Just looked it up.
But why?
Difficulty focusing on studying.
Oh, I see. And so now? How's it been since you've been taking it?
Much better.
Much better?
Mm-hmm.
Okay. Any other medical history? Any diabetes, high blood pressure?
My father has diabetes.
Okay. And your mom, does she have any past medical history at all?
No.
And yourself, do you have any diabetes, high blood pressure?
No.
Nothing. Okay. Are you allergic to any medications?
No.
Okay, good. Are you allergic to pets, dust, anything at all?
No.
Okay. No allergies in seasonal allergies or anything?
Mm.
Okay, I'm going to take a listen to your lungs.
Okay.
Okay, I'm going to take some deep breaths for me. Again. Okay. One more time. good. Listen to see if you have any heart murmurs. Have you ever heard of one of your providers telling you that you might have had one before?
No.
Okay. Let me just have you lean forward just a little bit. Take a deep breath and just exhale briefly. Like that. Okay. Let it out. Okay, very good. Okay. Okay, sir, I'm gonna have you lay back. Okay. Okay, sir, I'm gonna have you lay back. So the first thing I'm going to do is inspect your neck muscles, see how your jugular veins. Oh. Coming up what you see. Very good. There's no pulsating venous pressure, no extra, so you're good there. Right now, I'm going to listen to your heart. So I'm going to take your down waist here. And I notice that you have a tattoo here. How long ago have you had that tattoo?
2006.
Oh, okay. Did you have any redness or infection or anything from it?
No.
Do you have any other tattoos?
No.
Okay, very good. Excuse me.
Mm-hmm.
Okay, I'm inspecting your pericardium for any heaves or lifts. Now listen. Just relax for me. Good strong beat. Minutes are really long. Okay. Just gonna listen to the different heart sounds. Different areas that we put the stethoscope, your heart sounds just a little different. You have a very nice, strong heartbeat. No murmurs noted. Okay. So now I'm going to examine your abdomen. Have you eat
Regular?
regular appetite? Do you eat 3 meals, more than that?
2-3 meals a day.
Okay. What type of, do you eat fruits and vegetables, fiber? Okay, good,
A little
good,
bit of
good.
everything.
And your bowels, how many bowel movements do you have a day?
1 or 2.
1 or 2 a day? Are they soft, loose, diarrhea, hard, or
In the middle.
in the middle?
Comfortable, I guess.
Okay. So your contour is very flat. I'm going to listen to your bowel sounds now. Excuse me. Very good. Okay, very good. Okay, I'm going to be percussing. He's not used to anybody being over here. I did notice a dullness on this side, which is good. I'm going to do a deep palpation. Good job. Let me know if there's any pain or discomfort.
Okay.
Okay. All right, we can put your arms back in your sleeves. Great. Okay. I am Okay, so lower extremities, I'm just gonna look in here real quick. Sorry, so I gotta take your socks off and see if you're.
Gotcha. Okay, tight.
Good. Edema. Okay, put this so you can sit up. There you go. Okay. Hold your fine. Are you a runner? Do you run?
A little bit, yeah.
Yeah, okay. A lot of weightlifting, and you said you do play basketball, right? Correct?
Correct.
Okay. We're going to be checking your reflexes. And I'll get my cheat sheet out. Put that there. Here's one of them we can do. This is your, make sure, oh, this way. Okay. This area here. I know some of you be a little uncomfortable, and I apologize for that, but we want to make sure that your reflexes are working good. Let's see. So you have your knees here. Just try to relax. And that one is testing your cerebellar function. One more thing. Okay. So I know you're a very strong young man. So I'm gonna have you squeeze my hands. The other side, yeah. The
No, I mean for the.
bottom of your feet.
Mhm.
Okay. Squeeze your hands for me.
Oh.
Squeeze my hands. Very good. Okay. Gonna have you pedal like you. There you go. Push up against my. Okay. Push up against my hands. There. Good job. And thank you for reminding me, sir. Funny how that reacts like that, huh? So, I'm going to have you to, one more thing, okay. This is the last part of our exam. I'm going to have you step down and you're going to walk towards me and then back up to the room. And then we're going to bend over and check your spine. Here, I'll tie that up for you. Okay.
Walk
Look this way. Very good. Okay, have a good range of motion. Okay, so I'm going to have you just bend over, and I'm going to just touch your spine. Touch your toes. There you go. Okay. All right, so if you have a seat there, I think their physical examination part is over. Yeah. So I'm going to step out and let you go ahead and get dressed, and then we'll sit down and go over your exam. Okay. Okay, Mr. Russell, so your physical examination is done. I'm going to just do some more paperwork and get that ready for you. In the meantime, so there's some things I want to make sure that you do. One thing is for sure about the flu shot. You are going to definitely get that. Mm-hmm. And I don't think if I asked you about alcohol or drug use, do you take any illegal drugs like marijuana or meth or anything of that nature?
No.
Ever done that?
No.
Very good. And alcohol, do you drink any alcohol?
Occasionally.
And what's occasion?
2-3 times a week.
Okay. And are you at home, or are you out and about when you're drinking, or?
Usually out, but sometimes at home.
Okay. So if you're out, who drives home?
Roommate, friends.
Okay, so you have a designated driver.
Mm-hmm.
Very good, very good. All right then, well, I'm really impressed with your physical examination. Like I said, I'll get everything typed up and ready for you, and we'll be back and be ready to take that home. It was nice meeting you.
You as well.
Okay, thank you.